Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about nursing process in simple and easy. So go ahead, subscribe, and let's get started. Students, now we will see the definition. Here, it is explaining that nursing care is not done randomly, but in a proper step-by-step way. The nurse first checks the patient, then understands the problem, plans what care is needed, carries out the care, and finally checks whether the patient is improving or not. So, overall, it shows that nursing care is organized and done in a systematic way. Now we will see the first step of the nursing process, which is assessment. This is the starting point, where the nurse collects all the information about the patient. Here, the nurse asks questions like what symptoms the patient has and any past history. They also check vital signs such as temperature, pulse, and blood pressure. Along with that, the nurse observes the patient's physical condition as well as emotional state. For example, if a patient says they have pain, the nurse will not just stop there. They will ask where the pain is, how severe it is, when it started, and other details. So basically, assessment is all about collecting complete information to understand the patient properly. Now, let's understand the types of data we collect during assessment. In nursing, the data is mainly divided into two types: subjective data and objective data. First, subjective data. This is the information that the patient tells us. It is based on what the patient feels or experiences, so we cannot measure it directly. It comes from the patient's own words. For example, when a patient says, "I have a headache, I feel dizzy, my stomach is hurting, or I feel anxious," all these are subjective because only the patient can describe them. Next is objective data. This is the information that the nurse can actually observe or measure. These are factual signs that we can see, hear, or record. For example, temperature being 38 degrees Celsius, blood pressure 140/90, swelling in the leg, vomiting that we can see, or lab reports. All these are objective data. So in simple terms, subjective means what the patient says, and objective means what the nurse sees or measures. Students, now we will see the second step, which is diagnosis. After collecting all the data, the nurse now tries to identify what exactly the patient's problem is. Here, you should remember one important thing. This is not a medical diagnosis, like diabetes or hypertension. Instead, it is a nursing diagnosis, which focuses more on the patient's needs and problems that the nurse can manage. So basically, the nurse looks at all the collected information and understands what the patient is going through. For example, if a patient has pain due to an injury, the nurse may write it as acute pain related to injury. So in simple terms, diagnosis means identifying the patient's problem based on the data collected, with focus on care needs. Students, now we will see the third step, which is objective or goal. This is about what we want the patient to achieve after giving care. So once we identify the patient's problem, we set a goal for improvement. It should be simple and clear, like what change we expect in the patient. For example, if the patient has pain, our goal is that the patient should feel less pain after treatment. If the patient has fever, the goal is that the temperature should come back to normal. So in simple terms, goals are the expected outcomes we want to see in the patient after care. Students, now we will see the fourth step, which is intervention. This simply means the actions that the nurse does to help the patient. So after setting the goal, the nurse actually starts doing the care. These actions can be different depending on the patient's condition. For example, the nurse may give medicines, check vital signs, help the patient to move or take rest, give fluids or oxygen, and also educate the patient. So in simple terms, intervention is the actual care or treatment given by the nurse to improve the patient's condition. Now we will see the fifth step, which is implementation. This is the stage where the planned care is actually given to the patient. So whatever we decided in the planning stage, now we put it into action. The nurse gives medications, provides treatments, and also educates the patient. For example, if the patient has pain, the nurse may give pain relief and make the patient comfortable by positioning them properly. So in simple terms, implementation means doing the planned care in real practice. Students, now we will see the final step, which is evaluation. This is where the nurse checks whether the care given actually worked or not. So here, the nurse looks at the patient and asks questions like, did the patient improve? Were the goals achieved? If the answer is yes, then the care was effective. If not, the nurse may need to change or modify the plan. For example, if the patient says their pain has reduced, then we can say the goal is achieved. So in simple terms, evaluation means checking the results of the care given. That brings us to the end of today's session. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.